A group of pediatric organizations have declared a national emergency when it comes to children's mental health. The American Academy of Pediatrics, along with two other organizations, put out the warning late yesterday after learning of disturbing new statistics showing that the percentage of emergency room visits for mental health emergencies among kids ages 5 to 11 rose by 24% from March to October of 2020. And in kids 12 to 17, it was more than a 50% increase. The pediatric groups also highlighted the disproportionate mental health effects on children in communities of color, citing the effects of the pandemic and structural racism. In the meantime, this news comes just as Penn Medicine researchers have been awarded a grant of more than $14 million to study and develop suicide prevention interventions for underserved groups. So I want to bring in Dr. Maria Oquendo, Chair of Psychiatry at the Perelman School of Medicine at the University of Pennsylvania, and Dr. Gregory Brown, the Director of the Penn Center for the Prevention of Suicide. And they're joining in this morning to talk about the efforts that are happening here in our area. Good morning to both of you.
Good morning.
Good morning.
We first want to start off with this national emergency, this news that just came out. And Dr. Oquendo, I'd like to start with you. Are we seeing these same numbers in Philly, and should it be surprising at all?
We are seeing the same numbers in Philly, and honestly, with the pandemic and the quarantine and not having classes in person over the last 18 months, that was a huge challenge for children. They were socially isolated and also less stimulated by their environment.
And what about when it comes to children of color? Why is there such a difference when it comes to them?
One of the things that's been interesting is that the children of color typically have, certainly in terms of suicidal behavior, been relatively protected. But I think that the magnification of structural racism and the increased awareness about it and attention to it, I think has put extra stress on these kids.
And so, Dr. Brown, it sounds like when it comes to Penn, you guys have been aware of this. Obviously, this has been in the works, this $14 million grant, and these efforts that we're going to see in our area before the national emergency was declared. So what kind of things are we trying to do here in our area?
Well, thank you for raising this really important issue and for inviting us to be here. We're delighted. We are establishing what we call Innovations in Suicide Prevention Implementation Research Center. It's a big, long term. But basically what is happening is that we have treatments that work, treatments like safety planning intervention and follow-up calls after patients leave the hospital, and to kind of connect people to outpatient care. And so one of the things that we want to do is to help clinicians in the hospitals use these treatments, and that's what implementation science comes in, to make it so that these treatments are doable and can be used in a way that is going to be beneficial to the patients.
Now, what kind of treatments are we talking? Treatments to help with mental health issues, or when you say treatments, what are you referring to?
Well, we're really talking about treatments that focus on suicide prevention specifically.
Okay.
And people who come into the hospital with suicidal ideation or maybe have made an attempt, very high risk for suicide, and we need treatments that work to prevent a repeat attempt or lower the risk for suicide.
So would that be medication? Would that be counseling?
It's basically brief counseling that we use called the safety planning intervention, which is a brief one-session intervention to help people to recognize when they're in crisis, to use some coping strategies like distraction to deal with their problems, and to connect people to family members or to reach out for professional services for help.
If someone's watching right now and they know someone or they have a family member who struggles with this or is dealing with these issues, how can they get involved or how can they receive this help?
So we're going to start these studies in the emergency rooms in the Penn system. And so what we hope to do is have the opportunity to reach both adults, but also we have some projects that focus on children of color that are having a crisis, and make sure that they get the kind of treatment and follow-up that will help prevent further behavior. And I think one of the things that's novel about this is that for a long time in mental health, people thought that you should just treat whatever the other psychiatric condition is, whether it's depression or anxiety. But now we know that treating the suicidal ideation and behavior directly is very powerful.
So it's almost like a separate treatment. It's a separate thing you need to focus on, like you're saying, as opposed to just mental health in general.
Exactly.
Okay, and that's what this is going to focus on, that separate part.
Exactly, yes.
And the interesting thing also about this is that if someone's watching now, they can also get involved with helping this. How can regular civilians help out?
So one of the things that we will be doing is creating community advisory boards. We're really interested in engaging the West Philadelphia community to give us feedback, because if we make up interventions or implement interventions and the community feels they're not a really good fit, that's not quite as helpful. And so we want to make sure that we work hand in glove with the community to bring interventions to them that are acceptable, make sense, and are effective.
And when you say West Philadelphia, is that because what of all West Philadelphia deals with, or why West Philadelphia specifically, just to clarify for everyone?
West Philadelphia is where the University of Pennsylvania is, and where many of our emergency departments are.
Okay.
And so 3 of the emergency departments will be in West Philadelphia that we're working with, and we anticipate, of course, having more than that. We have 8 in total, but we will be focused on.
There.
We're starting there.
And then going to expand.
Exactly.
Gotcha. Where can people find more information about the center?
They could reach out to the Department of Psychiatry at the University of Pennsylvania. We are building a website to showcase the center. We also have our Twitter accounts that can tweet us, and we'll respond.
Okay, and what would you say to someone or a parent who's at home and thinking, wow, I know this is starting with the emergency room, but that can still be kind of concerning, because you think that's probably the last step and you want to try and do things so it won't get to that point, you know what I'm saying, to get into the emergency room. What advice would you have for them, or what would you recommend?
I think the most important thing, if you have a child that you're worried about, is to reach out to your pediatrician, because they're the first line of defense, if you will, and they know what the resources are in your community. So if you need to see a mental health care clinician, or you need to go to the emergency room, the pediatrician is well qualified to make that distinction and give you a recommendation.
Okay, and of course, you can always call the Suicide Prevention Hotline.
Absolutely.
And we do have that number up right now for everyone if you need it. That is, of course, always there as well.
Always there, yes.
Thank you, and thank you for doing this work. It's important work, and we'd like to follow along with you guys. Keep us updated as the center continues to improve and expand.
Thank you very much.
Yes.
Thank you.
Thank you. We're going to take a break.